final health assessment heading to S4 sheet, just on a book, nice and empty. It's my patient, I'm gonna bro, it's my brother. And this is the room. Loosen this back a little bit.
You loosen up that handle as well. It'll make it move smooth.
Get the floor. Up to 60 around there. Alright, that should be good enough. Alright. Get it back on you. Perfect. Alright. Beginning assessment in 3, 2, 1. Good afternoon. My name is Student Nurse Gambrell. I'm going to be doing a full head to assessment on you today. Can I get some identification on you?
Yes, sir.
Birthday?
March 24th, 1998.
Full name?
Owen Christopher Gambrell.
Perfect. Thanks.
You're welcome.
Okay. The first thing I want to do is get some vital signs on you. So first thing I'm going to need you to do is just roll up that right sleeve as much as you can. I'll get you just taken off. I'll do your radial pulse first. Okie dokie. I'm going to go ahead and check your temperature, then do your radial pulse.
Okay.
Can you go ahead and just move your hair out of the way a little bit? Yep, just like that. Perfect. .9. That's good. 98.9. Oh my goodness. So 98.9. Sounds like a radio station, huh?
Mm-hmm.
Alright. Next thing I'm going to do is check your radial pulse. Get my timer out here. Go ahead and flip your wrist out for me. In 3, 2, there's a timer, stopwatch. 1. Okay. There's 35, so for 30 seconds, for a full minute, that would be 70. So radial pulse of 70. So next thing I'm going to need you to do is just breathe normal. So hopefully that's not too hard to do. Go ahead and get my timer out again.
Should I lean forward?
No, you can just breathe normally.
Okay.
I'm just going to check your respirations. Beginning in 3, 2, 1. While I'm doing my nursing video, can you be quiet?
I'm sorry.
Alright. So you had 6 breaths in 30 seconds, so that would be 12 respirations, which is normal. Go ahead and just take off one side. Your right hand is your dominant arm, correct?
That's correct.
Alright, yep, just go ahead and do that. I'm going to go ahead and take your blood pressure. Respiratory rate was 6 at 30 seconds, so 1 minute would be 12. Perfect. Okay, I'm gonna go ahead and get your blood pressure. Just go. Alright, just lay it out normally. Perfect. Ah. Nah, I don't care. Get it on your brachial artery. Walmart brand. It's the good stuff. Alright, there we go. Get it on here. There we go. That's not too tight, is it?
No.
Just hold this for me with the other hand. Perfect. Go ahead and warm it up for you. Okay. Do you know what your blood pressure is normally?
No, I don't. It's been a while.
Probably no more than 140 though, so. Systolic 122. Diastolic 72. Alright. Thank you.
Yeah.
You can throw that gown back on if you want to.
Right.
122 over 72. For blood pressure. Just good. BP 122 over 72. Alright, so now I'm going to go ahead and begin your head to toe assessment. First thing I want to do is assess your, what do I do with that?
Did you sit that here?
Hand sanitizer.
Oh, here's.
Yep. So the first thing I'm going to do is assess your head, your neck, your eyes, and your mental status, okay?
Okay.
So I'm going to go ahead and assess your hair and your scalp. I'm going to be looking for abrasions and lesions. So I'm just going to go ahead and just look, parting the hair out the way, making sure to look behind the ears, on the back side of the neck, the other ear, the temporal. Go ahead and sit up for me. And you do use corrective lenses, not just, you don't use contacts, correct?
No.
Okay, perfect. There's no masses, abnormalities, lesions, anything like that, so that's good. The next part I'm going to do is an eye assessment. So just look straight at the camera for me,
Okay.
and I'm going to separate your eyes. Perfect. And again. So they're round, they're not too constricted or too enlarged. They do contract at the same time when I put light in one eye while the other eye is not exposed to the light, so that's a good sign. And yeah, there's no problems with the eyes at all. No redness, no hemorrhaging. They contract equally at the same time, so that's good. So next I'm going to test just ask you a few questions. So do you know where you're at?
Yes, I do. I'm in the doctor's office.
Okay. What are you getting assessed on?
I'm having a full body assessment done.
Okay. Do you know who brought you here today?
I drove here myself,
Okay.
actually.
Awesome.
So no one really brought me, quote unquote.
And do you remember the last thing you ate before? Or do you know what today's date is as well as the year?
Yes, it's April 27th, 2020.
Awesome.
And, well, that's the year. So
Yep.
Cool.
I just had to ask you a couple questions. Okay, so next, just to get a recap so far, his hair and scalp had no problems, no lesions, no masses, as well as behind the ears. His eyes checked out fine. No problems there, no abnormalities. Mental status is good. And next I'm going to check his neck. So just go ahead and roll this down for me. I'll get it. Alright. So the first thing I want to do is feel for crepitus, which are bubbles. And he has no crepitus. I'm just going to go ahead and start palpating. Feeling all along his neck. No masses, no lesions, no differences in skin tone. That's good. Alright, so the next thing I'm going to do is check your carotid artery. I'm going to do both sides, but don't do both sides at the same time, because that could make them feel lightheaded. So go ahead and sit like this for me, just normal, just rest. So I'm going to check this artery first. No brewing going on, nice strong +2. Good. I'm going to check the other side. Oh, as long with his radial pulse, it was also a +2, and no constant rate, no problems. Same thing with his carotid artery. So no problems with that carotid artery as well. +2, constant rate. So the next thing I'm going to do is assess your, or I'm going to auscultate your heart. I'm going to be listening for heart sounds, any abnormalities there. I'm also going to be finding your apical pulse, and then I am going to auscultate lung sounds. So just go ahead and take that gown off for me.
Okay.
And just try to sit back normally and put your hands by your side.
Like this?
Yep, that's fine. Alright. Alrighty, I'm going to get on this side so you can see what I'm doing. So there's a couple points we want to find during this, and we want to look in between the intercostal spaces, just so we don't have any density with the bones. First place we want to look is the aorta valve, and find that intercostal space. And that can be heard with no murmurs. Then we're going to go to the pulmonic valve, and that can be heard with no murmurs. Then we're going to go to Erb's point, which is third intercostal space with no murmurs. Then the mitral valve, no abnormalities. And then the tricuspid, and that can be heard with no abnormalities. This is also where his apical pulse was, and that could be heard with a resounding sound. Good contractions, no problems. So the next thing I'm going to do is just examine your chest in general. Hair distension is fine, or hair growth is fine. There's no abnormalities there. The skin tone is good. No masses on the chest. And the skin tone is good. No cuts, abrasions, contusions, or masses. So next thing I'm going to do is start with lung sounds. So at every point, I wanted you to take a full breath, okay?
Okay.
And the biggest thing here is to make sure you do your nice ladder shape all the way down. second, I gotta get in here. Go ahead. Go ahead. And it's important to get those higher parts because unlike the apices of the heart, the apices of the lungs are actually towards the top. So I was here, I'm gonna move here. Go ahead and breathe for me. Good. And really throughout this, try to get in between those intercostal spaces because the density of the bones will really subtract from the sound. Go ahead and sit up for me. Just a little bit. Oh yeah. Sounds good, buddy. So there's no crackling, no coarse breathing, no fine crackles, no pleural rubs, nothing going on there. Everything sounds great with his breathing and all his heart sounds. So next thing I'm going to get you to do is just stay just like this. And I'm going to check his distension of his vein, his venous artery, and there's no distension. Having him sit at a 45-degree angle, so that's good. So the next part I'm going to get you to do is go ahead and throw your feet that way and just have your back facing me.
Like that?
Yep. So I'm going to check, first I'm going to just inspect his back. I'm looking for any growths, masses, different skin tones, different hair growth. None of that here. I'm checking the ratio, 2-to-1 or 1-to-2. With this way his chest is facing in this way, and that's normal as well. Go ahead and sit up straight for me. Good. Okay. Both shoulders are level. Neck has no problems. I'm gonna go ahead and begin palpating. So I'm gonna palpate this, okay? Your shoulders, good. And just work my way down. Your spine and down the side. Good. So, like I said before, there's no abnormalities here. Nothing is twisted or looks to have any type of scoliosis there. No lesions, no contusions, no redness, no skin problems. So next thing I'm going to go ahead and auscultate your back. And again, just like we did with the lung sounds, go ahead and breathe every time my diaphragm hits your back, okay? Okay. Good. And the same thing as the front. Try to avoid the bones of the ribs. They do wrap around. The bottom two are hanging, which means they don't connect back. Also avoid the spine as well. You should be able to see this during inspection. Check to see if it's symmetrical with his body and his neck and his everything, just to check for scoliosis. Okay, no abnormalities in your lung sounds, again from the back. Alright, so the next thing I'm going to get you to do is just lay back like you were before. You can go ahead and throw this back on. Actually, let me check your extremities first, your arms. before I get you to put that back on.
Okay.
And then I'll check your abdomen as well too, just so you don't have to throw the gown on and throw it up. Okay, so go ahead and face me. You just have your hands out normal.
Like this?
Or just like this. So the first thing I want to do is just check all his arms, palpate all the way up. And there's no masses, cuts, lesions, contusions. I'm going to check capillary refill on both hands. 1, 2, perfect. 1, 2, perfect. Now I want you to try to put force against my hands with your hands. Good. Flip them over. And do the same thing. Good. Act like you're going to give me a high five. Do the same thing. Don't push with your arms, push with your hands. Good. Okay, so go ahead and sit back normal. So the next thing I'm going to do is I already checked your radial pulse. On this side, I'm going to go ahead and check it on this side to make sure it's there. I'll check this in. And it is indeed. Go ahead and throw your fist in a ball. Good, and let it out. Good. Do the same thing with my fingers in here. Good. Release. Okay, so he's got good range of motion in his wrist and the hands. Can I get you to raise your hands up like this? Push. Good. So he has good range of motion in his shoulders as well. And go ahead and do the same thing with your elbow, bringing it towards your midline. Good. Same thing here. Good. Okay, so range of motion in his arms are good. I can find his radial pulse on both. Capillary refill is good. He's got healthy nail beds, and he has no lesions, abrasions, contusions, or skin problems on either arm. No masses as well when palpating. Good job, man. Okay, let's go ahead and sit back. And for this one, another thing I was looking for when I was palpating was any type of edema, and he had no pitting going on anywhere. And I'll check your legs later for the same problem. So the next thing, I'm gonna actually have to get you to lay down a little bit more for me. So just kind of like put your butt here, because I want to really get your abdomen relaxed.
Okay.
Okay, good. I'm not gonna palpate yet, because sometimes if you palpate before you auscultate, you can disrupt some of those vowel sounds. So the first thing I'm going to do is palpate each quadrant of your abdomen. I'm going to be listening. Usually you listen for a full minute. That's what you would do in a clinical setting, but just for our purposes, I'm just going to do 15 seconds in each quadrant, so it'll take a full minute. Good. One thing you want to listen for here is, since the apices of the heart and the stomach are relatively in the same place and they make sounds, it's good to know the differences between each sound and where those sounds would be located and what they sound like. For him, it's easy to discern between his bowel sounds. It should sound more like liquid rather than a muscle contraction. So I'm going to go ahead and start in this quadrant. Good. 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 Okay. And like I said before, you would do that longer during a clinical setting, but just for this purposes, we're not going to do it that long. I actually do have a couple questions for you. Have you had any diarrhea or vomiting lately?
No.
Have you been eating irregularly?
No, I'm keeping up with it.
Okay. And then some more questions. Does it hurt when you use the bathroom, peeing, or number 2?
No.
Okay, good. So the next section you would check is his inguinal area, which is between his belly button and his hip bone. So that area right above his junk. So I would do that, but since for this sake, I'm just going to do it outside of the clothing. But if, like I said before, if it was a clinical setting, then you would definitely have to. So what you would do is you would palpate for the femoral artery and inguinal artery here and here. And then once you're done with that, this is when you're going to begin palpating. Your stomach should be nice and relaxed. And since you've already auscultated, you can go ahead and palpate. So what I like to do is I like to start on the side. Just feeling for any lumps, masses, just try to relax on. Across the stomach. And do the same thing here, you would. And you would check down here and here. Just for lymph nodes, masses, pain, things like that. And I completely forgot to ask you, you don't have any pain right now, correct?
Oh, no.
Okay, good. Good to hear. You didn't seem like you were in any pain. Go ahead and sit up for me. So, one of the final things we're going to do is check his legs. So the first thing we do when we always check something is we want to just inspect. Want to inspect the hair growth on both legs. Obviously trying to compare each time you inspect something that has something subsequent to it, like fingers and hands and arms. So we're going to check just both legs for symmetricality, knees, calves, toes. Just look at them, everything looks normal. No lesions or cuts or masses, no skin problems, no dryness, no problems with moisture. Perfect. Okay, so the first thing I'm going to do is palpate on. So when I do this, I'm just going to, let me know if you have any pain throughout it.
Okay.
And I'm going to check your popliteal artery. Go ahead and set it up like this. Sounds good. Okay, go ahead and put it down. Same thing with this one. Sounds good. Okay. And the next thing I'm going to do is check your artery on your foot, which is here. I can really feel that. And do the same thing on this side. Make sure not to use, just switch your hands around when you're using the opposing part of your body. And I can really feel that. Awesome. And then check the one behind as well. And I can feel that artery too. Okay, so another thing I want to do is check your range of motion of your knee and your ankle. So just go ahead and put this up. And try to straighten it. Good. Now try to come up. Good. Do the same thing with the other side.
Okay.
Try to come up. Good. Try to come down. Good. So anytime there's resistance, that means there's strength in it, and therefore range of motion should check out. Before this, when he was walking to the bathroom, I followed him. He had a normal gait. He walked fine, so I didn't think there were any problems with range of motion before the examination. And now that I've tested him, there still concludes my thought. So now I'm going to go ahead and try to do this with your ankle for me. Yep. Good. Same thing with the other side. Perfect. Now try to put some pressure up it, like we did with my hands. Good. Do the same thing with this side. Good. Alright, so now I'm going to check capillary refill on his toes. Good. Good. Both feet had normal capillary refill times of 2 seconds. And the final thing I'm going to do is check for, go ahead and sit up a little bit more for me. Next thing I'm going to do is check for pitting edema. So the thing for edema is you want to check something that has a bone behind it. This is important because you could just be pushing into a calf and somebody could have already a large calf, and yeah. But the types of skin against bone does not change unless they have edema. So I'm pushing against the shin. Obviously no edema, no pitting in general. And he didn't have any edema throughout his body when I was checking his arms as well. And he doesn't in his legs either. Okay, good. You can go ahead and throw this back on for me, bud.
Okay.
Do you have any questions?
No, not at this time.
Okay. So normally what you would do